Happy Monday, moldies. I would say happy Monday morning, but as you can tell from the darkness behind me, it is not actually morning anymore. Again, crazy day. But at least I'm making it on Monday, so it can still be a Monday musings for my moldies. It's just not a Monday morning musing for my moldies. It is what it is. Happy Monday. I hope you guys all had amazing Thanksgivings. If you celebrate, if you don't, if you're in other countries, thanks for tuning in. And it might be Monday morning for you. So that's good news. Today I want to talk a little bit about a test that I just added on thanks to my good friend and amazing functional medicine colleague, Ellie Campbell. She is an incredible functional medicine doctor, and one of her goals is to eradicate people that have a known cause for cardiac dysfunction, dying of strokes and heart attacks. That's one of her jams. So she recently released a new functional medicine book on how to stop people, basically a layman's guide to blood pressure lowering and things we can do in the functional medicine realm to lower our long-term chance of coronary disease, stroke, heart attack, all of that fun stuff. So, of course, since she is a good friend and a soul sister of mine, as soon as that came out, I bought it on Amazon and read it. Obviously, it's a layman's book, so it was fun. I think I read it pretty quickly. But one of the takeaways that I didn't know that she's always been talking about is bacterial colonization of the mouth and what that leads to long term. Now, this is really funny because I remember going to a functional medicine conference eons ago. And now obviously my dentist had been telling me for years that you needed to floss. I use an electric toothbrush. I always have, and have really good results. But my dentist was always like, Tammy, you really need to start flossing. And I could never force myself to do it. Well, I went to one lecture on the connection between the bacteria that we find in plaque, especially the plaque that gets stuck there that, your dentist has to use that like drill to get out, and it's terrible and it causes us all to hear fingernails down the chalkboard. Well, I heard one conversation about that at a functional medicine conference and I started flossing. It was like that was enough to change me. Well, I felt the same way when I was reading Dr. Campbell's book on natural ways of getting out of our body's way to heal from coronary things. So basically, one of the things she does, and she does it pretty much across the board, which is what I'm going to be offering to all of my patients, is a salivary test. And as you guys know, in the functional medicine community, there's no such thing as a reasonable functional medicine test, right? They're all expensive. You guys, just like I do, we all max out our HSA, and that's what we use for our natural healing. Well, this one is really reasonable. It goes for about $150. So it's a really reasonable test. And what it does is it tests for the 5 most common bad bacteria that you can be walking around with in your mouth that leads to long-term cardiac manifestations, right? Whether that be stroke, whether that be hypertension that's not manageable. Incredible. $150 test that's going to tell us our risk factor for coronary heart disease. So this is what I decided to do on Monday Morning Musings. Of course, after I found out about it, I reached out to the company that she talks about in the book. I got an account. I did myself, Hubs, and the bestie. We did our 3. We got our results back. I started doing some studying on how to treat it because, of course, before I roll it out to you guys, as always, everything that I do to you, I do to myself first. So did some learning, started the Hubs on his treatment protocol, starting the bestie on her treatment protocol coming up here. Mine, of course, as always happens. I feel like if you're in healthcare and you try and get something, probably if anything's going to go wrong, it's going to happen to your sample. Well, they lost my sample. That's what they said at first. And then they said that there was no saliva in there. So they are rerunning my sample today. So I haven't started my treatment protocol, but the protocols are really easy. It basically is dedicated antibiotics for the bacteria that you have in your mouth for 10 days and then retest. If you're a current patient of mine and you are interested in the test, I encourage you to reach out and schedule a follow-up. If you're doing great and you just want to do this test, we can do a quick 15-minute visit, get that kit sent out to you, and get those results to reduce your long-term sequelae that is associated with coronary heart disease, with stroke, with heart attacks, with hypertension, with all of this stuff. If you're not a patient and this is something that appeals to you, please reach out either by calling at 920-412-8184 or by reaching out online, either by booking an appointment or sending us an interest form on www.thelidacenter.com, and we will get you back so we can get you on the schedule. Again, it's just such an incredible screening tool for such a reasonable cost. So I just wanted to talk about that today. Super excited about it. Super excited to get my results. Super excited to see how my hub's blood pressure responds and Bestie's blood pressure responds with treating these infections. And I know how everything that happens here goes straight to our heart. So it makes so much sense. I hope you guys all had an incredible Monday filled with so much love and light, and that you're not freezing your dupas off because it is ridiculously cold. But I hope that you're filled with warmth from your heart, your soul, and all the amazing family moments you had this last holiday weekend. Today and always, I'm sending you so much love. If this video resonates with you and you want to share it because you want people to know about what your functional doctor is talking about, or conversely, you want to introduce, one of your friends to functional medicine that doesn't know kind of what we do in our root cause medicine, please don't hesitate to share this. Sending you guys so much love today and always. I'll see you next Monday.